Good evening, everybody. Here we are. We are live. Sorry, I'm running a bit late. I'm in my living room tonight. Got the Christmas tree up. Doesn't that look nice? My wife has done a wonderful job of doing the decorations. I'm sitting on a leather sofa this evening, so I apologize if it's a bit squeaky. Anyway, right. Sorry we're late. We have our first hello. We have our first shout out, and it's from Charmaine Lang. Hello. Hi, Charmaine. Katie Crane is also saying hello. This is good. We've got 50 people logged in already. That's quite a good start. Lewis Spriddle saying good evening. Evening, Lewis. So I'm sorry if I've missed people out already. 80 people now logged in. Wow. Here we go. Okay, first question. This is good. What causes mouth ulcers? That's a question from John Anderson. Carrie Watson wants a shout out. Hi, Carrie. You did message me as well, so here's your shout out. Hi, Carrie. Nahida Parveen wants a shout out. Ruth Hyde. Hi, Ruth. Ruth, you've sent me an amazing message tonight. I'm so pleased. Things worked out well. I won't talk too much about it in case we don't want enough people to know what's up, but congrats. Well done. I'm really pleased. Deepa Patel saying Christmas tree. Yeah. Kaylee saying hi. Lauren Marie, saying hello. Hello, Lauren. Right. Okay, anyway, I'm going to go back to... Oh, who have we got? Shout out, please, from Tiffany Stout. Anyway, listen, guys, I'm going to go back to... Debbie... I keep trying to go back. Everyone just wants shout outs. Debbie from Dunmurray Dental. Sarah Rosa saying hi. Faye Vaughan. Hi, hon. Hope you're good. I'm very well, thanks. How are you? Good evening from Colombia. Nice. My cousin Amir just logged in. How are you, cousin? Okay. Yes, Arsenal won 4-1. It was a good result. That's why I'm running a bit late. I had to watch that. My good friend Avix just logged on. How you doing, Av? See you this weekend. Anyway, right. What was I saying? We've got 180 people already. I ain't even been on. Okay, timer. 15 minutes. I'm not doing any longer. I've already been on for 2-3 minutes, but 15 minutes tonight, 100%. I'm going to do 15 minutes and I'm going to call it a day. Right, so here we go. Kitchen timer again. 15 minutes. Let's do this. And that's it. Right, shout out. Gaz is... Oh, sorry, I missed it. Anyway, listen, someone asked the question. I want some dental questions as well, please, tonight. First question we had... I've just had another one here. Hayley Bishop wants to shout out to all the dental nurses. Big up all the dental nurses out there. We couldn't work without you guys, so big up all the dental nurses. Cousin Amir, hi from Sweden. Yes. So we had a question just then. Can you still do root canal if you have an abscess? Right. So most of the time you're having root canal treatment on your tooth because you've got an infection or you've had an abscess. If you've got an active abscess, it's there. Yes, you can. Sometimes you have to really get in there and open the tooth up to allow some of the juicy pus that's in there to come out of the tooth. So you can. But definitely your dentist will be able to advise you further. It depends how swollen and things it is. But yeah, you can. But the first question we had, someone got in earlier. I think it was John Anderson. He came in and said, why do we get mouth ulcers? Good question. We don't really know. There's loads of different reasons why you can get ulcers. Stress can bring them on. Some people are just more predisposed to them and just get them for no reason at all. Trauma can do it. So if you bite your tongue, if you burn your mouth, roof of your mouth, like pizza burn. So if you bite into a hot pizza and the hot cheese goes straight up, that's what causes mouth ulcers. So loads of different reasons, but sometimes you just get them for no reason. You could be run down. You could have changed your diet. You could have eaten too much of something and then suddenly your mouth just reacts by having an ulcer. So you can get them for lots of reasons. But here's the key thing. If you ever get an ulcer and it's there and it lasts for more than 2 weeks, definitely go see your dentist or see your doctor and get it checked out, because sometimes there could be nasty things lurking. So make sure you get them checked out, but they should normally just go within a couple of weeks. Right. Let's get back to some shout outs. What we're doing. Can we use adult toothpaste for my 2-year-old? Also reasons why not. Okay, that's a good question. Adult toothpaste. So if you look at the adult toothpaste, the thing is, the reason we say you want to use different things for kids is because if you've got adult toothpaste, sometimes they have too much fluoride in. So what you want to look at is the fluoride concentration is 1,450 parts per million. Now, you can actually use that for children, but you just got to make sure you use the right amount. So for 0 to 3-year-olds, we say just a very, very small smear of toothpaste, tiny little bit. For 3 to 6-year-olds, you can go for a very, very small pea-sized amount. And for over 6, then you can just use a regular amount. But the thing with adult toothpaste, they're often quite minty and they can be a bit too strong for the babies, for the kiddies. So that's why adult toothpaste isn't so good for them. That's why. So kiddie ones have weaker flavors. Right, let's do some more shouts. Cherie Parker, hi Cherie, how are you? My cousin just logged on. He's there already. He asked a question, I missed it. Shout out from Durham. I have a wisdom tooth with a hole in it and my dentist refuses to take it out. Why? I don't know. Maybe have another chat with your dentist. It could be quite difficult, maybe, to remove. It might be more risks outweigh the benefits. I don't know. I have to see it, really. Someone's saying they're digging the beard. Thanks very much. I freshly trimmed it up for you guys tonight. Leanne is saying, hi, Rita. My name's Mill, but never mind. Millard, you know, whatever. Yeah. What's your favorite part of being a dentist? It's being able to help people and taking people that come in and they're in pain and they're nervous and then changing their attitudes and making them better. That is genuinely the best thing about dentistry, is making people better and also being creative. You know, as dentists, we like to think of ourselves as D for doctor, EN for engineer, and TIST for artists. We're doctors, we're engineers, we're artists. Yeah. And we're very nice people. Another question. What is the easiest way to get my 10-month-old baby to spit or rinse? Oh, big Gaz. Alexander from Armenia. Big up the Armenian crew. What is the way to get a 10-month-old to spit? It's really hard, actually. You have to kind of teach them how to spit because babies just want to swallow stuff. So it's quite hard. With my daughter, she's nearly 3, I just used to get her to copy me. So I'd kind of brush my teeth and brush her teeth, and then I'd spit and then just sort of lean her over the thing and try and get her to spit. But spitting is something you kind of have to learn. 10 months might be a bit early, really, but try. They just got to watch you and kind of see how they can do it. Okay, I've got a tooth being taken out. I'm so scared about it. Don't be scared, Rachel. I'm scared of the dentist. Everyone's just saying this. I'm scared of the dentist. Why? Why are you guys scared? Have you had bad experiences in the past? Do you just not click with your dentist? Do they not sing songs like, I like your molars, molars? Do they not sing songs like, Return of the Plaque, there it is? Do they not say, you might be gappy? You know, you got to find something in common with your dentist. Make sure you're comfortable with them. A lot of dentists out there are good guys, you know, or girls. We're trying to be nice. We're trying to help you guys. So you just got to try and let them know you're a bit nervous. We're trained for it, but you know, you've got to get a good relationship with them and trust your dentist. We're there to help you guys. Okay. I've got a question here. Shout out to Amy Chambers, actually. It's a question. My dentist said I need a mouth guard as I grind my teeth and they are chipping. How do I apply the mouth guard? It's a good question. So mouth guards, I do make them, a lot of them. Mouth guards, so they're actually called splints, dental splints we call those. And yeah, they prevent grinding. They kind of reduce the forces that you create. So basically when you go to bed, you really kind of chew your teeth if you're a grinder. And you can chip them, you can cause cracks in them, you can cause pain, you can get jaw pains, headaches, migraines, neck pains, loads of things that come from just grinding your teeth at night time. And sometimes even clenching your teeth. So some people just sleep like this. Like that. Let me show you again. That's how they sleep. So stress. We all have a very stressful life these days. So that's kind of what's increased the old clenching and grinding things. So what the mouth guard does is you put it on. So basically you just brush your teeth and just put it on your teeth. And that's it. Your dentist will show you exactly what you need to do. But you just basically put it on. And that's it. And then it reduces the forces. So it may not stop the clenching or grinding, but it will protect your teeth a little bit while you're doing it. All right. Karen Glaze. Hi, Karen. How are you? The dental nurse loves you. My dentist is not happy. Maybe he's jealous. What can I say? But thanks, Karen. You're a good supporter of mine. I really appreciate all your efforts with Craig David, trying to get him on board. Who knows? One day it might happen. Singing dentist back to back with Craig David. I was in my surgery and this patient comes in and he says, hey, doc, I have got toothache. Fill me in. It's done. Let's get Craig. I really want to make it happen. Okay. First time watching Dentist Live on Facebook. Can I have a shout out, please? Big up, Pete. First principle. Thank you for tuning in, Pete. I really appreciate your support. I wish you was my tooth. That's from Molly. Do you mean I wish you was my dentist? I don't know. Okay. Is Colgate Peroxyl mouthwash any good? Actually, yeah, I do like Peroxyl. So it's a peroxide type mouthwash. As you rinse with it, it kind of releases like all the oxygen. It goes all frothy and stuff. It is quite good. We used to use it quite a lot for wisdom teeth kind of infections in the back if you got a little bit. So I used to like it. It's quite hard to get now, but you can still find it. So yeah, it can be pretty good. But it's not like an everyday mouthwash. You don't want to use that. It's only for specific things, minor mouth irritations. If you do get some ulcers, it can help a bit. So yeah, it's not bad. Right, big hello from Sydney. That's from Sana. Wow. In Australia. I got a lot of fans in Australia. So, big up. Daniel John is saying you're a lovely guy. Oh, thanks, Daniel. You're very kind. Jason Ward wants to shout out. Big up, Jason. What song are you going to do next? Good question. So, have you guys seen the one I've got out now? with my special guest. So that was a parody of Black or White by Michael Jackson. Simon Cowell White, we called it. It's all about tooth whitening. Give you some good messages. That was lovely. Big up Steve Hewlett. He's a wonderful ventriloquist. He came down. We had a lot of fun. So big up Steve. That was really fun to do. Oh, we got some more shout outs. Hello from Michigan. That's from Alicia. International. Okay. I've got a question here. Whitney's asked a few times. Do you sort your family's teeth out? And who does your teeth? Who does? Yeah, I do my family's teeth. And I kind of do my own teeth. Yeah. Because I trust myself, you know. It's hard to find a good dentist. I'm joking. Someone said I met you at IAFA. IAFA was wonderful last Saturday. Big up. Nice. Zen Orthodontics, I think it was. Yes. Oh, yeah, I remember you guys. Big up the Zen Ortho guys. Okay. There was something I was going to say. Oh, yeah, the next song. The next song is going to come in probably about a week and a half. It's a Christmas song. So I've parodied a Christmas song. There's a clue in my latest video with the Simon Cowell. So if you watch that, you'll get a little clue as to what's going to happen. Loving the tree, says Faith. Yes, look at that. Isn't that amazing? My wife did a wonderful job, Stella, and my daughter, my 3-year-old, was helping mummy hang the stuff. That's cute. Okay, great songs. Big up the Singing Dentist. Thank you very much. Which is better, floss or teepees? That's from Leanne. That's a good question. So, floss or teepees? If the gaps are big enough and you can force in an interdental brush, then teepees are good. If the gaps are too tight and you just can't get the brush in, then flossing is the way. And then you can also get the flosses on sticks, so they're a bit easy to use, a bit like a catapult like that. You can get in there. Dentec is a good company, they make them, so you can check them out. You should come and visit our dental practice in Exeter. I've never been to Exeter, so invite me and I might come. Tom Coe has just logged in. Big up, Tom. Tom's helped out with something amazing. I'm going to tell you guys about it next week. I'm going to launch it first on the website, so keep an eye out. Also on the Facebook page, I'll tell you all about it, something exciting. But I'm going to really go into it next week on Tuesday, so wait for that. Ah, yes, something as well. People keep asking. Hold on, someone just said, Edward Crouch, your beard should have its own channel. Thanks. People love my kind of face, my hair on my face. If it's not the eyebrows, it's the beard. Thank you very much. All right. Oh, yeah, I was going to say something. People are asking about my mug. Not this. The Singing Dentist mug. Here it is for those of you that haven't seen it. Booyah! The Singing Dentist. Look at that. I mean, who wouldn't want one of these? And check this out. Check this out. You ready? Boom! Brush your teeth. Get it? Look, tea. Like cup of tea. That was my wife's idea. Big up my wife. Brush your teeth. So these little novelty mugs, Christmas is coming up. So if you'd like to purchase one of these Singing Dentist novelty mugs, there's a stocking filler. Genuinely, I have made quite a few of them and you can now purchase these. I will tell you tomorrow how to do it, but basically it's going to be on my website. So www.singingdentist.co.uk. We will go live with these hopefully tomorrow, and you can buy these bad boys. And they'll be £5, including the postage. So I'll post them out to you, and all the proceeds, all of it, 100% of that £5, we are going to be donating to Great Ormond Street Hospital. It's a wonderful hospital here for kids that aren't very well, and they look after them really, really well. So all the proceeds of these. Oh, it's backwards. Well, I don't know. How am I supposed to do it? Joke. I need to get another mirror and then I can reflect it. But anyway, look, this Singing Dentist, that's my face, isn't it? That's there. And then this says brush your teeth, but it's obviously backwards, isn't it? It's not very good. Anyway, you can buy these. £5. And we will donate all of that money to Great Ormond Street. So www.singingdentist.co.uk. Check it out tomorrow. Hopefully we should go live and you can buy these. Right. Okay. Where are we? Let's carry on. Do you ship overseas? Yeah, why not? Will you ship it to Spain? Yes, I will. I'll send one to you in Spain. Yes. Wherever you guys want. Does the £5 include a checkup? That's from Sam. No, it doesn't. Checkup. Cheeky. Anyway, that's the mug. Oh. I won't send that one. I think I just broke it. Okay, can I get your signature on the mug? Oh, yes. I'll tell you what. Who's that from? Nira. I will sign it for you. If you buy one, message me and I will sign it and I'll send it. How amazing is that? It's because it's on the front camera of your phone. Yes. Thanks, Richard. How are you, mate? Hope you're well. Yes, I know. Thanks. A bit embarrassing, that, wasn't it? I didn't really think that through. Anyway, any more teeth stuff? So come on, guys, ask me a question. How many times should I use mouthwash a day? Mouthwash. If you're brushing effectively twice a day and you're using something in between your teeth, so floss or TP brushes or whatever in between the teeth, then the mouthwash is a good adjunct to what you're doing. So it's good on top of, but you shouldn't use it as a replacement for effective brushing. So for the patients that think you can just rinse your mouth with mouthwash and it's okay, and then you have to worry about cleaning properly, I'm not a fan. So how often do you need to use mouthwash? Well, you don't. If you brush your teeth well, twice a day with an electric toothbrush, even a manual if you do it well, but electric is a lot better, and use good toothpaste, and you clean in between your teeth at least once a day, you don't really need mouthwash. So don't use that as a replacement, please. Your teeth are beautiful, says Molly. Thanks. They're a bit small because I'm actually a grinder. I do grind my teeth, yes, so I wear an appliance every night. It's called an SCI, a sleep clench inhibitor. Big up my cousin who was mentioning that. He's also a dentist in Sweden, Amir, very talented guy. We also have another dentist in the family, my other cousin in San Francisco. Just got into dental schools out there, some of the best ones. I'll tell you more about that later. But anyway, yes, who else? Josephine is saying, this is hilarious. Thanks. I'm trying to make it fun, but at the same time, I would like some dental questions. I keep missing loads. Guys, another thing, I'm so sorry if I missed your questions out, if I've missed your shout out. It is literally non-stop. It is just pouring. What is the best toothpaste? I don't really mind what toothpaste you use as long as you use it. So yes, as long as you use some toothpaste, as long as it's got fluoride in it, 1450 parts per million, use whatever you'd like the flavor of. Unless you want to get something that's specifically for something. So if you've got sensitivity, there are some that are better. If you've got more gum problems, there's some that are better. If you would need more fluoride to help protect your teeth, there are some that are better. But as a general toothpaste, someone just said, haha, you're a legend. Sorry. That's from Kit Chow. Wanting a shout out. Thank you, Kit. What toothpaste do you use? Whichever one I get sent free samples of. I'm joking. I think I'm using Colgate at the moment. That's where it is. Can tooth whitening be done by anyone other than a dentist? That's a good question, Shiraz. How are you, mate? Not really. It can be done by a hygienist or a therapist under the prescription of a dentist. So yes, but it cannot be done by like sort of other non-qualified people. I have a new song about that. Simon Cowell White. If you're thinking about doing some whitening, see your dentist for Simon Cowell White. That's how it goes. Check it out. It's on the page. Guys, that was the 15-minute buzzer. I promised my wife tonight I would stick to 15 minutes because I end up doing like half an hour of this and I do ramble on quite a lot. So 15 minutes is over so quick. I'm sorry, guys. I'm going to have to call it a night. The Singing Dentist toothpaste. Oh, yes. How could I forget? That is still coming. I promise you guys. It's in stability testing, I think, at the moment. So that basically means we need to make it and leave it and make sure that it's safe to use even after a long period of time. So it's coming, though. I will 100% let you know. And that's it. Thank you all for tuning in. I really appreciate your support. The next one is coming. Oh, I've just got one more question. This sounds quite good. Hi, I suffer with jaw locks and clicks. It's so painful. I don't grind my teeth. What else could it be? It could. Have you had an injury to your jaw before? Have you kind of been bashed in the face maybe? If it's not that, it could just even be clenching. You don't have to grind. So grinding is this. But clenching is this. You see the difference? That's it. So you don't have to you don't have to grind to get jaw problems. You can just clench, and actually clenching, you create a lot of force on your jaw muscles. Facial muscles on your jaw joints. Sorry, facial muscles are very, very strong pound for pound. Small muscles can create a lot of force. So you've got to be careful if you're clenching or grinding. Speak to your dentist about getting a mouth guard or an SCI, which is the ones I make, sleep clench inhibitors. Do some googlies on that and you'll find out. Anyway, guys, listen, 15 teeth. Oh yeah, wisdom teeth. My cousin just said it could also be wisdom teeth. Yeah, if you're getting kind of jaw problems, jaw pains, it could be the wisdom teeth doing something that's making that. What was the mug website again? The back to front mug. Look, it says brush your teeth like cup of tea, but you can't tell that because it's back to front. But you can find them on my website, www.singingdentist.co.uk. Hopefully they'll be up tomorrow. But anyway, listen, guys, I've got to go. And I will speak to you guys. I might do one this weekend. I've got another really busy weekend coming up. Lots of exciting things happening this weekend. I can't wait to tell you guys what's going on with Singing Dentist. There's loads of exciting things. So I will tell you all about it. I'll keep you guys posted. But I might go live again this weekend, just as a special. Anyway, send me some messages, guys, if you want more stuff. And I will speak to you all next week. Thanks again for tuning in. Thank you again all for the support. And see you next week. Bye. Brush your teeth.